We start right now in Texas, where health officials have confirmed one measles death amid an outbreak that mostly involves young, unvaccinated children. This is the first measles death here in the United States in a decade. Texas reported the first infection just a few weeks ago, and there are now 124 cases across 9 counties, and more than a dozen patients are currently in the hospital. Doctors say that measles can spread pretty quickly, and it can cause serious symptoms, including brain swelling. They are urging families to get vaccinated before it's too late. NBC News correspondent Sam Brock is on the case. Sam, just walk us through what's new. What are the new efforts to get this under control, and what do we know about the person who died?
So first of all, measles is incredibly infectious. It's easier to spread than flu, than COVID. It sits in the air for an hour and a half to 2 hours after the person has left. So if you're vaccinated, Morgan, that's fine. If you're not vaccinated, you are vulnerable. So what we've seen in Texas right now, it's the rate of increase. Over the course of the last 2 weeks, it's gone from about 30 confirmed cases to 60 to 90 to 120. So it's effectively doubled twice each in 2 consecutive weeks. That's where we stand right now. You mentioned the 124 cases there geographically within the state. This really started in Gaines County. It's a Mennonite community, the Panhandle, West Texas area, but it's spread to the northern tip of Texas. You have it in central Texas, even neighboring New Mexico. And those are sort of a snapshot of some of the other states that are affected right now. The commonality in all this, the nexus point, is that those are communities affected where you're seeing rates of people that have not been vaccinated as high as the actual standard. It's 95% for the country, but only 11 states meet that threshold of 95% vaccination or higher. Most are below that, and about, I think, 14 are below 90, which is when you start getting into dangerous territory.
Look, I feel like we can't ignore sort of the political moment we're also in this country, right? Where there's just a lot of concern, right? There's a lot of reticence to when it comes to vaccinations, and there's a lot of misinformation. What are doctors doing right now to combat that misinformation?
They're trying to address the people that are out there, for one, saying that this is actually not a function of people not getting vaccinated, but it's the vaccines themselves that are creating the outbreak of measles. There's not a single documented case of someone getting the disease, measles, from a vaccine. In fact, it's the fact that they're not vaccinated that's the issue here. What the vaccine does is it stimulates a response in your body that will create symptoms like a low-grade fever or a rash, but not the actual disease itself. You can't be conflating the two things. RFK Jr., his former nonprofit, he's no longer connected with them, obviously, as he takes the HHS secretary position. But someone associated with it recently, and our Brandy Zadronzi did a great job highlighting all this, discussed the fact that he believes it's the vaccines themselves. That's been refuted by the medical community for a long time.
False information, to be clear. So just underscore for our viewers, not true information.
Not true. But the reality is that measles was declared to be eliminated in the United States back in 2000. Here we are, 25 years later. And I'm not saying that that's what's going to happen, is that status might change. But if we see right now we have 150 cases, if it gets to thousands of cases and it's months of continuous transmission, that status could change. And that's a really scary idea.
That is not the vaccine. It is the disease. It is the virus. That is an issue. All right. Sam Brock, thank you so much for your reporting in real time, fact-checking for us. We appreciate it.
Thanks for watching. Stay updated about breaking news and top stories on the NBC News app or follow us on social media.